Asthma is a lifelong disease that affects 8% of the population, and rates are rising. Even more troubling is that 10 people die of asthma in the United States each day. Allergist Dr. Sheila Bonilla at Methodist Hospital of Southern California discusses asthma and who is more likely to have it.
Asthma is a chronic disease. It's an inflammation of the lungs, and it can be triggered by environmental factors if inhaled through the respiratory tract. Asthma runs in the family. It's more common in boys than girls in childhood, but in adulthood, it's more common in women than men.
Dr. Bonilla lists the common symptoms of asthma.
The symptoms of having an asthma attack is wheezing. It can vary. Wheezing can be felt as a shortness of breath, or when exercising, limitations of activities. Just walking maybe a block and you would have to stop and rest. This rest will not be able to remediate it. It may take about 30 minutes to an hour for the shortness of breath to go away. Because you can present as an infant with respiratory type of problems, including cough or runny nose type of symptoms, or viral infection that seems to be recurrent as an infant. And with a family history, if you come to me, I will diagnose you with asthma, more likely than not. As an adult, and you will probably present with a chronic cough, a cough lasting over 6 weeks, maybe even up to 3 months.
Treatment for asthma gives people control of symptoms.
Asthma is an inflammatory disease, so we do treat it with an anti-inflammatory type of medication. Most of our asthma medications are in an inhaled form of a device called a metered dose inhaler. You may have seen one of those. It's something that you put in your hand and you puff it into your mouth, and you have to inhale it. And that's how the best way to get into the lungs for this steroid inhaler to get in. But for the most part, what we give you is what we call albuterol. It's also in a metered dose inhaler. It is what we call a rescue inhaler. However, it does not do anything for the inflammation. It will bring you relief within 15 minutes, however.
Dr. Bonilla talks about the importance of managing asthma.
If an asthma is not controlled, it can be triggered by allergies or viral infection or even pollution or an irritant in the air. The management of asthma really lies on prevention. So knowing what your asthma triggers are, knowing what symptoms you have, and preventing this with the use of medications will prevent these triggers. And so patients do not go to the bad asthma attack. We prevent an attack. That is the management of asthma.